10 symptoms of pancreatic cancer that will shock you. Critical warning signs. Pancreatic cancer is a disease in which malignant or cancerous cells develop in tissues of the pancreas. The pancreas is an important organ that lies behind the stomach and in front of the spine. It produces enzymes that aid digestion and hormones such as insulin that regulates blood sugar levels. When it stops functioning properly due to cancer, several critical bodily processes are negatively affected. Unfortunately, pancreatic cancer is one of the most difficult cancers to detect early because it doesn't cause any noticeable symptoms in its early stages. By the time symptoms do appear, the cancer has often spread to other parts of the body, making treatment more challenging. According to the American Cancer Society, about 62,000 people are diagnosed with pancreatic cancer each year. And if you want to know whether you could be at risk for this deadly disease, make sure to watch this video to the end. But before we dive into the topic, don't forget to like and subscribe for more health-related content. Here are 10 symptoms of pancreatic cancer that will shock you. Number 1. Unexplained weight loss. When it comes to weight loss, everyone wants to shed those extra pounds. However, when the weight comes off unexpectedly and without dieting or exercising, there may be something wrong. Losing weight can be one of the first warning signs of pancreatic cancer. As the cancer grows, it affects the way your body processes nutrients, leading to unintended weight loss. Studies show that patients with advanced pancreatic cancer lose an average of 10% of their body weight over the course of the illness, but some lose much more. So if you notice unexplained weight loss, especially when there's no obvious cause, consult your doctor immediately. Number 2. Abdominal pain. Abdominal pain is a common symptom of pancreatic cancer, especially when it's in an advanced stage. The pain is usually felt in the upper abdomen and may radiate to the back. This type of pain is often constant and may worsen after eating. The pain is caused by the growth of the tumor pressing on nearby nerves and blood vessels. Additionally, pancreatic cancer can lead to inflammation of the pancreas, which also contributes to the pain. In some cases, the pain may be relieved by leaning forward or sitting up, whereas in others, lying down may provide relief. It's important to note that abdominal pain alone is not enough to diagnose pancreatic cancer. Other conditions can cause similar symptoms, so it's crucial to seek medical attention for a proper diagnosis. Number 3, jaundice. Jaundice is a condition that causes yellowing of the skin and whites of the eyes due to a buildup of bilirubin, a yellow substance produced during the breakdown of red blood cells. When the bilirubin level rises in the blood, it can cause jaundice. Pancreatic cancer can cause jaundice by blocking the flow of bile from the liver to the small intestine. This blockage causes the bilirubin to build up in the blood and can lead to jaundice. Jaundice can also be a sign of other conditions such as liver disease or gallbladder problems. However, if you notice that your skin and eyes are yellow, it's essential to seek medical attention promptly. 4. Changes in stool. Changes in stool, such as a decrease in stool volume or a change in color, can be a sign of pancreatic cancer. These changes occur as a result of the digestive enzymes produced by the pancreas being reduced or altered. Additionally, if the stools float, this could indicate that there is fat in them. Fat in the stool can be a symptom of pancreatic cancer because the cancer cells can block the flow of digestive enzymes to the small intestine. Without these enzymes, fats cannot be digested properly and they end up in the stool. It's essential to note that changes in stool alone are not enough to diagnose pancreatic cancer. Other conditions can cause similar symptoms, so seeking medical attention for a proper diagnosis is crucial. Number 5, loss of appetite. A loss of appetite is a common symptom of pancreatic cancer, which can be attributed to several factors. As the cancer progresses, it can release substances that alter your body's normal metabolism and digestion process. This can lead to nausea and vomiting, making it difficult for you to eat. Additionally, the growth of the tumor can put pressure on nearby nerves, causing pain that can worsen with eating, thus further reducing your desire to consume food. This loss of appetite can also be influenced by hormonal changes in the body as a result of the cancer. All these factors combined can lead to significant weight loss and malnutrition. If you notice a sudden loss of appetite, it's essential to seek medical attention to rule out any underlying conditions. 6. Dark urine. Dark urine can be a symptom of pancreatic cancer due to the effect it has on your body's digestive process. When the pancreas is unable to produce digestive enzymes effectively, your body may not break down certain components of your food, such as bilirubin. Bilirubin is a brown substance that is normally broken down by the liver and excreted through urine. However, when it builds up in the bloodstream, it can cause your urine to turn dark. Additionally, pancreatic cancer can cause dehydration, which can make your urine more concentrated and darker in color. If you notice that your urine is dark and accompanies other symptoms such as abdominal pain or jaundice, it's important to seek medical attention right away. 7. Clay-colored stools. Clay-colored stools are a less common but still potentially significant symptom of pancreatic cancer. They occur when there is an obstruction in the flow of bile from the liver to the small intestine. Bile is a substance that helps break down fats and give stools their normal brown color. When the flow of bile is blocked, the stool becomes lighter in color because bile cannot reach the intestines. This blockage is often caused by a tumor in the pancreas or the bile duct. If you notice that your stools have become clay-colored, it's important to see a doctor for further testing. Number 8. Itchy skin. Itchy skin, especially around the abdomen, can be a sign of pancreatic cancer. This symptom occurs as a result of the buildup of bile acids under the skin. When the pancreatic duct becomes blocked, bile acids can enter the bloodstream and travel to the skin, causing intense itching. Additionally, pancreatic cancer cells can release histamine, which can also cause the skin to become itchy. It's important to note that itchy skin alone is not enough to diagnose pancreatic cancer. Other conditions can cause similar symptoms, so seeking medical attention for a proper diagnosis is necessary. Number 9. Swelling in the legs and ankles. Swelling in the legs and ankles, also known as edema, can be a sign of pancreatic cancer. When the cancer spreads to the veins, it can block the flow of blood and cause fluid to accumulate in the tissues of the lower extremities. Additionally, the liver, which is responsible for removing toxins and excess fluid from the body, may not be functioning properly due to the cancer. This can lead to a buildup of fluid in the abdomen and legs. If you notice swelling in your legs and ankles, especially when accompanied by other symptoms, it's important to seek medical attention. 10. Feeling full quickly. Feeling full quickly after starting a meal is a less common but still significant symptom of pancreatic cancer. This symptom occurs as a result of the growth of the tumor pressing on the stomach, which can reduce the amount of food you can eat before feeling full. Additionally, pancreatic cancer can lead to inflammation of the pancreas, which can cause pain and discomfort when eating, making you feel full faster. It's important to note that feeling full quickly alone is not enough to diagnose pancreatic cancer. Other conditions can cause similar symptoms, so it's crucial to seek medical attention for a proper diagnosis. Conclusion: pancreatic cancer is a challenging disease to diagnose in its early stages because it often doesn't cause noticeable symptoms until the cancer has spread. However, being aware of the potential warning signs and symptoms can help individuals seek medical attention promptly if they notice any unusual changes in their bodies. Remember, early detection and treatment can significantly improve the outcomes for individuals with pancreatic cancer. It's essential to prioritize your health and consult a healthcare professional if you experience any concerning symptoms. Thank you for watching this video. If you found it informative, please hit the like button and subscribe for more health-related content. Stay healthy.